people who deliver medical care have become so diverse that it's hard to keep who's who straight. People use the term doctor on name tags so that when you go in as a patient, you see Dr. so-and-so, you don't know their degrees. They could be a physician's assistant, they could be a nurse practitioner. But if they're not an MD, a medical doctor, or a DO of doctor of osteopathy, they're not a physician. And it's really important for patients and their families to know that, because the role of the physician is radically different than the role of a physician assistant or a nurse practitioner. The role of the physician is to coordinate care. It's to branch out and speak with other specialists. It's to understand the patient holistically. Doctors' educations are very, very long. They require at a minimum 11 years. So you have 4 years in college, and in those 4 years you learn a lot. And then in medical school, doctors learn medicine, and we learn science, we learn people, we learn interviewing skills, we learn the professionalism that sets doctors apart from other members of the medical profession. You know, being a physician is not a job, it's a career identity position. And part of that identity has to be part of society and has to be branching out and treating not just the patient in front of you, but society as a whole. And doctors, just as a virtue of their experience and training, are uniquely poised to do that. Doctors are in a unique role. We're the ones who should oversee all aspects of care. Our colleagues do parts of care, and our job is to pull it together. The job of the doctor is to speak to other doctors and other specialties to coordinate the overall medical care of the patients. It's a unique role, and patients who have complicated problems should be treated by doctors. There is a role for other members of the treatment team, but the job and role of the physician is to pull together all of the overall care. The most important thing for a patient and their family member to do is to understand who's who that's treating them. And you have to ask. If somebody is not a physician, you want to know what is their role on the treatment team. Non-physicians have very important roles on the treatment team, but it's incumbent on all of us as patients and family members to know those roles. So simply ask,